Welcome to the Mount Pleasant podcast, featuring discussions and interviews about the people, places, and events that make Mount Pleasant such a special place.
This is the Mount Pleasant podcast. I'm your host, Brian Cleary, and all thanks to the great people at Mount Pleasant Magazine, I get the honor, the privilege of introducing you to Mount Pleasant, the people who make it such a special place to do business, to work, and even to live. We're introducing you to Mount Pleasant's best on the Mount Pleasant podcast. Health is something that everybody talks about. It's a concern to everyone, so it's going to be our subject today here on the Mount Pleasant podcast. And we brought in somebody who is a coach, and we all know that coaches know everything, or at least we'll find out if this coach knows everything. I'm Brian Cleary, joined today by Maryann Loucks. Marianne, you are with Metabolic Medical Center. You're a health coach. Do people actually call you Coach Marianne?
I have had some of my clients call me Coach Brian. But typically they just call me Marianne. So you can call me Marianne, or you can call me Coach Marianne if you want.
Well, we'll go with Marianne. Now, on your business card, on your nameplate and everything, it's Marianne, health coach, and then CFNC. What would CFNC, what does that stand for?
That stands for Certified Functional Nutrition Counselor. So my training is in functional nutrition counseling, which basically means that we kind of look at the whole person, not just what you eat, but how all of your body systems work together and how you react to different things that you put in your body, basically.
So Maryann Loucks is with the Metabolic Medical Center. And when people hear the word metabolic, not certain, Marianne, I think people think they know what that is. How would you explain metabolic?
Okay, that's a great question, Ryan. When your body metabolizes things, it's how your body uses what you're giving it. So when we think of our metabolism, when you eat something, how does your body turn that into energy? Or when you're drinking water, how do you use that? So basically and when we talk about metabolic syndrome, which a lot of our patients have, it's when you have those things that interfere with your body working to its best functioning. Things like diabetes, type 2 diabetes, or like heart disease, or different types, hypertension. So all kinds of different things interfere, and we call those things metabolic syndrome. So our goal at Metabolic Medical Center is to help people to be in the best condition that they can, so their body can use what it has to the best of its ability, whether it be the food that you're eating, the exercise that you're doing, so how you're metabolizing and using things for the best that you can.
Wow, those are words people really want to hear, because everybody obviously wants to feel good. So let's turn and let's talk a little bit about, on a bigger level, Metabolic Medical Center. Let's go big and then we'll drill down small. Tell us about the services that you actually offer there.
Okay. Yes. So Metabolic Medical Center has been in business for 27 years in the area. So we've been servicing people in the Carolinas for a very long time. And we have multiple different programs that we can use to help meet people's needs. So we are a physician-based weight loss program, and we offer many different tools and resources to help people get to their weight loss and health goals. So we do offer food replacement supplements. So in the form of like a high protein shake or oatmeals or juices. So protein is very important in weight loss because you want to build lean muscle mass. So we offer that. We also offer oral appetite suppressants that help people to control their appetite. So we kind of think of some of our supports like training wheels for people to help you get the right mindset so that you can get a jump on your weight loss and your health. And then you have an opportunity to either let go of some of the stuff or add different things. So sometimes people will add some of our other options like B12 and lipomino shots. Those basically aid in weight loss as well, and also help people with energy. We have a lot of patients that come in are just really low in energy. Then we also offer our newest addition to our program is the semaglutide injection, which is an injection that you take through an insulin needle, and it's a very painless injection. It helps to balance your blood sugar, and it also helps to curb your appetite. So these are just different supports that we have, along with the health coaching, which helps people work on diet and lifestyle factors that will help them with more long-term maintenance of their goals.
As a health coach, you see a lot of different things, different body sizes, different people, men, women, the whole thing. Everybody wants that quick fix. I mean, I want to lose weight. I don't want to have to work too hard on it. You see a lot of that, but obviously everyone's a little bit different. So you're dealing and offering different things based on the need of the individual.
Absolutely. And what we try to do is we try to customize a program to fit each person's needs. Some people may not be able to take appetite suppressants because they might have some heart conditions. So that's fine. You don't need to. Some people just opt for health coaching or for exercise programs. Some people do a combination of multiple programs. So it's very individualized, and we like people to feel very comfortable that we can help them and meet them wherever they are.
Podcasting has exploded in popularity, especially local podcasts. As of 2022, 62% of Americans have listened to a podcast. 38% have listened in the last month. 26% in the last week. The podcasting audience is booming with no signs of slowing down. Call the podcast hotline to be featured on these podcasts or to receive information about podcast marketing. Call 843-530-0403 or visit carolinapodcasts.com.
You're listening to the Mount Pleasant Podcast.
And speaking of meeting with people, for people who want to know where your location is, fill us in on that.
Yes, so we are located in Murrells Inlet. We are at 3955 17 Bypass. So we are on the northbound side, and we're in Unit C. There's a bunch of other buildings here. So we're right in Murrells Inlet, just north of the Waccamaw Hospital.
And Marianne, this is just you and me talking right here. There's a magic pill, right? There's something that I can go in. You don't have to tell anybody else, but just me, because I want to lose like 10, 15 pounds. It'll just happen like that, right?
Yeah, no. So we do have, things that can help you, but we have some remarkable results with people. Depending on the program that you choose, in a month, you can lose anywhere, from 10 to 20 pounds. Typically, once you get in a regular routine, you can lose 2 to 3 pounds a week. Sometimes people will take it off very quickly in the beginning. So if you're talking about like a magic pill, once you change your lifestyle factors and you get a little help, you can take off weight pretty quickly. The trick is to keep it off. And that's where we really want to work with people so that they're not just coming in and, I dropped the 30 pounds and now see ya. Okay, goodbye. But no, we want to get you to what we call maintenance, where you know how to maintain that weight on your own, Brian. And if you go up 5 or 7 pounds, you come right back and see us and we'll readjust, because we want you to have a good experience. We want you to be healthy, and we want you to be able to maintain it on your own.
We're talking health and wellness today on the Mount Pleasant Podcast. I'm Brian Cleary. Thanks ever so much for joining me. This is where the pages of Mount Pleasant Magazine come alive. And today, from the Metabolic Medical Center in Murrells Inlet, we're joined by a health coach. Maryann Loucks is our guest. And Marianne, when you were growing up, you were a little girl, 6, 7 years old. You wanted to become a health coach. How is it that you got into this line of work?
Actually, this is my second career. I spent 25 years in public education in upstate New York, and I was a teacher. And I was, for the last 8 years, I was in professional development. And that is when I started with cognitive coaching. When I moved down here to South Carolina, I was also battling my own health issues. And I decided that I wanted to take my love of teaching and my passion to try to get healthier, and make it more of a profession for myself. So I transitioned to a health coach later on in life, after a long career and a relocation and my own health challenges. And what inspired me to do that was the fact that I wasn't getting answers from doctors and I was feeling very stuck. So I said, well, if I can't get answers from doctors, then I'm going to try to figure things out on my own. So I decided that functional nutrition counseling was the right thing for me to pursue. And as a result of that, I've been able to help so many people over the years to just improve their lives and ultimately, the majority of my clients that I've had have been weight loss clients. And when the owner of Metabolic Medical Center, when Ray Waits reached out to me, I thought this would be a great fit for me because it would give me an opportunity to help so many more people than I could just on my own. So that's kind of what brought me to Metabolic and to my career now.
So from upstate New York down to the Hammock Coast community, winter's a little better down here, I would have to say.
A little bit. Yeah, just a little.
Everybody has to ask, do you miss the snow? That's the question you probably get a lot, right?
Yeah, I don't miss it. I loved it. And there was a time in my life where, we played in the snow, and as long as you have stuff to do in the snow, it's great. It is a lot of work though. Yes. My husband can attest to that, but I don't miss it, but it's a nice place to visit. I've been there and done that. So.
Perfect.
We're beach people now.
That's what I was just going to say. I'll take the sand over the snow any day of the week. So you certainly 100%. Made the right choice coming down here and enjoying all the greatness that South Carolina has and Murrells Inlet has to have. That ride on 17 is just so much better than, say, 95 or whatever.
Yep, absolutely.
So health and wellness, that's got to be a good feeling then, knowing that one-on-one you can help people. Go beyond weight loss though. So let me get you on something. When you talk about diabetes, it's such a huge concern here in South Carolina, but across the nation. For someone who's diabetic, give us some tips and some things that you've had to deal with and help people with.
Okay. Yeah. So there's basically, Brian, 5 areas that I focus on with people. And this goes for anybody with either type 2 diabetes, weight loss, or any sort of health struggle that you're having. So I kind of start with some basic things. So first, nutrition and hydration. Having, we talk about a balanced diet, but we get into more specifics of, protein, healthy fats, fibers, drinking plenty of water. That's very important to be hydrated. A lot of people will often go to the hospital and they're dehydrated. So all those things are important, not just for people who are diabetic, but in health in general. Also, exercise and movement. We have several people who come into our clinic that are getting ready to have surgery on their knees or on their back. And what's happened is they can't exercise because they're in pain, but they can't have the surgery to reduce the pain so they can exercise. So it's really just, like a catch-22, like how can we help them? So we talk to people, when people think exercise, they automatically think you have to go to the gym. That's not necessarily what it is. Can you walk, to your mailbox? Some people, it's just, can you walk to your mailbox every day? So getting an exercise and movement. Sleep is important, and rest. We don't prioritize that enough. And a lot of times when you have people whose metabolism is off, or they're hanging on to extra weight, I always start first with sleep. How are you sleeping? Because there's a lot that happens overnight. I use the analogy of Disneyland. During the daytime, Disneyland's a busy place and, everything's hopping. And then at night, there's a cleanup crew that comes in. And the same thing happens with our bodies. There's a cleanup crew that comes in overnight. So if you're not getting the proper amount of rest, your hormones and things are not doing what they're supposed to. So, a suggestion for anybody is that check in on your sleep and work on your sleep protocols. Stress and resilience to stress is important too. I have many people who walk through the door who say, basically, they're, how did you get to where you are? What brought you to us? And basically life happens. They've had deaths in their families. They've had children that they're taking care of. They have parents that they're taking care of. They've moved. They've had job changes. I mean, you name it. All those are stresses that we have. And then the last area that we focus on is might not seem like the first thing you would talk about with health, but it's the sense of community and relationships. And oftentimes our health is not the best if we don't have healthy relationships or support systems in place or networks. So we talk about that as well. So those are 5 areas that I would address with anyone with diabetes or anything else that they walk through the door with.
Maryann Loucks is our guest today. She is with the Metabolic Medical Center in Murrells Inlet. We're talking health and wellness with me, Brian Cleary. Maryann, you run through some things that seem pretty simple, But even, and I would say I'm guilty of this, like drinking water. Is there a way to put importance on that? Because that's so easy to do, but so many of us don't.
Yeah, so we suggest that people drink at least 64 ounces of water. Some guidelines say half your body weight in ounces of water. But, just to give you an idea, look in the toilet after you pee. If your urine is clear or a light yellow, chances are you're well hydrated. If it's darker colored, you might want to drink a few more glasses of water. So just keeping hydrated is so important for your organs. It also flushes your system out. So people who are hanging on to extra weight, also it hydrates our organs. So people don't think of weight loss and your liver, but your liver is very important to support during weight loss because it does help flush out toxins in your system. So just quick tip there, look in the toilet.
You deal with a lot of people. You talk with a lot of different folks who come to you for all kinds of different reasons. But in the end, everybody's looking to be healthy, to feel better. For you yourself, is there a frustration? Is there one thing that people seem to come to you over and over again and you're just like, this is easy. If you would just do, is there one or two things that really just make you crazy?
Well, one of the things that made me crazy about myself as well is going back to those 5 areas is sleep. People really are sleep deprived. There's very few people that come in that say, oh yeah, I'm getting lots of sleep. I feel well rested. There's so many different factors in this day and age, and sleep is something that we have some control over. Many of the things we feel like we don't have control over, but sleep is something. So I always like to start with that. I try to prioritize my own sleep. I mean, I know how I feel on a night that I had good rest and the night that I didn't. I'm sometimes like 2 different people. It's harder to function. And I look at a lot of people, especially people who do shift work. I've had a lot of clients who did shift work in the past. So their circadian rhythm, their cycle of sleep is all off, and that affects their hormones and everything. So sleep is my one, if I was going to say my pet peeve of things that I really like to get people to focus on for their own personal health, because it is so important. And oftentimes we think of it as, I'll sleep when I'm dead. Well, if you don't sleep now, you're going to be there sooner than you think.
I have to think the challenge and both maybe one of the more rewarding parts of what you do and on the other side, challenge, so many people come in, you're helping them, but everybody's got that unique challenge and there's always not one answer. So like with sleep, everybody's different or no, everybody should get 8 hours.
General guidelines are between 6 to 8 hours, but I know some people who need a good 9 hours of sleep. Some people are fine with 6 hours. But the guideline that I give people is listen to your body. You know if you're getting enough sleep and if you're not. I'm a 7-hour girl. Like I need a good 7 hours. If I go to bed too early, I'm up at like 3-4 o'clock in the morning, ready to go. Like, okay, now I'm ready. But I think that, teaching people to record things and journal things and write down when you went to sleep. How did you feel when you woke up? How did you feel the rest of the day? So helping people get in tune with their bodies and find out what's best for them.
And I have to think as a health coach, that's probably your number one thing, because whether it's for sleep or diet or exercise, you've got to talk with everyone individually to make a best plan for them. Absolutely.
Yep.
So Metabolic Medical Center is an alternative for people and not an alternative in this. Here's where I'm trying to get to. There's lots of different outfits out there. Everybody's yelling at you saying, no, this is how you lose weight. This is how you lose weight. So what is it about for you and for somebody listening to the podcast today? Metabolic Medical Center. I should choose them. You guys are different. What is it that should make me want to go, no, I've got to call and talk with Marianne?
Well, that's a great question because we really pride ourselves on the team that we have here at Metabolic. We have wonderful physicians, health coaches, medical technicians, pharmacy techs, receptionists, all the way down the line. You're going to interact with people who love coming to their job, doing what they're doing, and they're really invested in making it a personalized approach. So we're going to help people to find what works right for them. It's not a cookie cutter approach. There's not one size fits all for a weight loss program. And every single person that they're going to come across throughout the process is going to make them feel comfortable. It's a safe place. We get all kinds of people that come in, and we are just very in tune with finding an individualized approach that's going to work perfect for you.
You talked early on about how you love to teach. You've been able to have a second career out of this. I guess it has to be the most rewarding part for you when you're able to coach someone, and you never get to the finish line in health and wellness, but boy, you certainly can put them a long way down the road to being healthy.
Absolutely. One of the things that I really enjoy is when people come in and they're stuck. And I think a lot of people just feel that stuckness of, in their heads, they know what to do. The logic tells them that, but there's something that's just keeping them from doing what they know they need to do. So one of the things I really appreciate is when I help someone become unstuck, find sometimes it's a simple solution. Like sometimes they'll say, oh, I don't know what's going on. I've gained 5 pounds this month. I said, well, let's go through. What are you doing? Oh, we've been getting that fried chicken for lunch every day. Oh,
guilty.
Fried chicken. Yeah, you can relate. And sometimes, it's one of those things where they've plateaued and they're just this close to their goal. And it's just like, okay, what can we do to get there? We brainstorm, we go through things. And, with one patient, it was, let's expand, let's not eat for 2 more hours in the morning. You normally eat at 6 o'clock. Let's try 8 o'clock instead. So just extending that fasting period overnight for 2 hours, took the weight off, feels great, met his goal. So for each person, really helping to illuminate some solutions to their problems and helping them see that they do have some control over that. As a coach, that really is important to me, and it's very rewarding.
You want to get healthier, you want to lose weight, you want to just be better, coach. You've got to reach out to Coach Marianne. If somebody wants to get in touch with you, is there a number they can line to find out more about the Metabolic Medical Center?
Yes, definitely. They can call us at 843-357-2851, and we'd be happy to get you on our schedule. I'd be happy to do a phone consultation. Whatever your health and wellness goals are, give us a call and we'll see how we can meet your needs.
Will there be any cheerleaders? Do I need to bring my own pom-poms?
You can bring your own pom-poms, or, somebody actually asked me if I had a whistle as a coach. So I keep saying I've got to get the whistle. But yes, there's a office full of cheerleaders here. Okay. If you come, Brian, we'll bring you some pom-poms. How's that sound?
I'm in. Give her a whistle, give her a clipboard. She is Coach Maryann Loucks. She is with the Metabolic Medical Center in Murrells Inlet. Health and wellness. They're part of the Hammock Coast community. Marianne, thanks so much for taking the time to join us today on Mount Pleasant Podcast.
Thank you so much, Brian.
And for you listening and watching, thank you so much. The pages of Mount Pleasant Magazine come alive here with me, Brian Cleary, on the Mount Pleasant Podcast.
Thanks for spending your time with the Mount Pleasant Podcast, your community, your podcast. Listen to past and future episodes at mountpleasantpodcast.com.